So it's been a little over 5 minutes, and I created a superior force through the hip joint into the ilium. And now we're going to test the results. And you'll recall that when she was supine previously, and I tested posterior rotation, this feels different. This has a different qualitative feel to it. This opposite PSIS doesn't rise up immediately. Okay. Comparing sides, it's more similar than it is different. Okay. Let's have you lie on your stomach now. So previously, the right sacrotuberous ligament was prominent and taut, and now I can indent it. Okay? So we've made a change in the tone of the ligament that connects sacrum and ischial tuberosity, called the sacrotuberous ligament. And you'll recall that there was no superior mobility, and now I can see your head bob. I can see your head move up. So I can take up the slack through this structure now using about 15 pounds of force. And now I'm going to add an additional 15, spring it, and it moves. There's a little slight movement through your whole body. So the movement now is happening through the sacroiliac and into the rest of your body. And now I'm going to test inferior glide. And I can take up the slack now. I couldn't do that before. And now I can spring it inferiorly. So it's moving in both directions. So let's have you lie on your back now. And I'm going to put that little thing there for your head. So now I come underneath and I have there's a deeper space on the right. So I think something has changed. I'm going to spring the transverse process and your head and neck glide to the left very freely with just a small amount of digital pressure. Now I'm going to come underneath and I don't feel the rotation anymore. The atlas, or the first vertebrae, C1, is no longer prominent on the right side, and I can lift up and I can induce rotation very easily with a small amount of digital force. Now I'm on top of the mastoid, and I can rotate you on the right, and now I'm underneath the mastoid, and this is where there's a restriction. I cannot side bend you. Okay, so I think this is a separate pattern. We gained 3 movements, but there's one that's missing, and I'll restore that by simply tractioning your head and then putting you in side bending and then giving a little extra distraction on that right side. And I think we'll just let the camera keep rolling, and I'll do this for at least a minute, and I'm doing little tiny oscillations on that right side. And so you had a right side bending fixation in the occipito-atlantal joint, the joint that forms between the occiput, the part of the head, and the first cervical vertebrae. And it's a skilled touch. It's a skilled, well-practiced effort at developing this skill set. It's not a typical physical therapy evaluation or treatment. Okay, so I'm going to bring you back to neutral, and now I can lift up and I can induce side bending. Okay, and what I'm going to do now is test traction with contact above and anterior to the ear, so I'm isolating the upper 2 joints and you are still restricted. So this is a symmetrical restriction, and I'm putting you in flexion now, and I still cannot create traction. So you're compressed in the upper cervical spine, certainly at the atlas, atlantoaxial or C1, C2 joint, and maybe also at the OA joint, and you're compressed here as well. Okay? This is an unusual finding. Usually people are, if they're restricted in 2 directions. You are restricted in 3 directions. So that's absolutely fascinating. And so I'm going to do some suboccipital muscle work. Some people do a suboccipital release with cupped hands and they put that underneath into the soft tissues. I use the technique where you actually bend your metacarpophalangeal joint 90 degrees using your lumbrical muscles. And that allows me to stay underneath that for a longer time. If my fingers were bent, were flexed, as in the traditional release, they would fatigue easily. So I'm going to do that for 2 minutes. I'll probably traction you in neutral for 2 minutes and see how you respond to that. But I think what I'll do is stop filming now and we'll treat that next.